As the surge in COVID-19 cases continues, we are also seeing hospitalizations increasing almost daily. The surge in patients being treated at area hospitals strains hospital resources and staff. ABC 7's JC Navarrete gives us a look at how resources could be getting stretched thin. He is live now. JC?
Yes, Steph, good evening. 260 plus patients in the hospital, 100 in the intensive care unit. And you would think, of course, that capacity issues start to rise. Well, right now, the capacity in beds is actually not the main concern. It's actually staffing. And if these hospitalizations continue to increase, questions now rise as to whether or not there's going to be enough people on staff to tend to everyone. We asked the city what they planned on doing with this issue. Here's what they had to say.
We still have plenty of bed capacity. The focus right now is working with the state to try to augment staffing for the hospitals.
Office of Emergency Management Coordinator Chief Jorge Rodriguez said hospital beds are not the issue at the moment. However, hospital staff could become a problem going forward.
Every hospital has their own plan, as mentioned before. We know that that staffing issue, that might be a challenge to the hospital, but each hospital has done everything possible to address those challenges.
We reached out to the major hospitals in the area. They tell us they have been able to adapt to the surge in patients, but if this uptick continues, valuable staff may have to be brought in from out of town.
The amount of people that can get sick at the same time and that require hospitalization. We need to be able to care for the patients of El Paso, whether it's COVID related or not, in a way that is going to be not to overwhelm our healthcare system.
The need for nurses is nothing new, with many registered nurses being in retirement age. Many are leaving the profession. The outbreak of COVID-19 does not help.
They are experiencing is having to take nurses off the regular units and sometimes move them to other units. And you've got the struggle of taking care of the COVID-19 patients plus the regular patients that are coming in.
One advantage playing out is nursing schools are allowing students in early graduation.
Last spring, we were able to graduate students on average about a month earlier than usual. And we think it'll be even easier now because of the surge of patients. Hospitals are going to need new nurses, and we think that will solidify their chances for getting good jobs.
And Woods does tell me that the university there does graduate roughly 150 nurses, registered nurses, after every single academic year. So, of course, a big help coming from there. But again, the main issue here is to keep those hospitalizations down. And the way you do that is by social distancing and, of course, wearing your mask. Reporting here near downtown El Paso, JC Navarrete, ABC 7.
All right, JC, thank you for that live update.